Before any of that, though, we're going to kick things off, as we will every day here on the Hard Shoulder, with our afternoon update, catching you up on all that has happened today, the stories that matter most. And joining me for the afternoon update today, Fionnan, Sheehan, Ireland editor with the Irish Independent, and Hannon from Off the Ball. As you will have heard from Eamon in the news headlines there, I guess the kind of news development of the last couple of hours here in Ireland has been the death of Jason Hennessy Sr. He had been shot. People will remember this gun attack at Brown's Steakhouse in Blanchardstown on Christmas Eve. He'd spent the last 11 days in Connolly Hospital in Blanchardstown, but Gardaí confirming this afternoon that he has died. So a murder investigation now underway into his death. One of the gunmen that night, Tristan Sherry, was overpowered and fatally injured as well in the night. So a murder investigation already happening there. 3 men arrested, 1 man charged. So because of that charge, there's very little really to add to that. But if there's any more developments today or in the coming days, we'll be sure to bring him to you here on the show. Fionnan, the COVID-19 inquiry, though, we do have detail we can talk about on that. So what has emerged? Do we have any idea what it's going to look like? When is it going to happen? How long is it going to take?
Yeah, we're expecting that in the next 3 months that government is going to set something up, terms of reference currently being drawn up. So we'll need to see exactly how wide-ranging it is and what's the purpose of it as well. I mean, go back a decade and there was the banking inquiry. We have to have a banking inquiry. We have to learn what happened and how it can't happen again and blah, blah, blah. By the time the banking inquiry report came out, nobody gave a shite, really. Pardon my French. But it was basically just a process that was gone through. A report came out at the end of it, and really, are we any the wiser? Probably not. In the case of the COVID inquiry, what is being said is that this is not about blaming people. It's just about assessing, here's what happened, here's how we responded, and here's the lessons that can be learned in the future. Now, if it's a political forum, then that becomes about who can we blame and who can we pick on.
Yes, as I said, the road to hell is paved with good intentions.
Whereas this is intended to be more kind of an independent expert panel type thing, not an Oireachtas committee where you've got point scoring and things like that going on. So it should look at the health professionals, should look at people affected, but it will have to look at the overarching policies to see how well prepared were we in the first place, how did we respond, and how did the structures operate, and where did things fall down. So I don't think they're going to be coming back and saying, well, you lifted restrictions on such and such a date and you had to put them back in 6 weeks later and therefore you shouldn't have done that. It would appear to be more overarching policy outlook focused. And you'd say that's kind of no harm, because we saw things like the operation of NEFIT, where this body of 40 health officials basically became the de facto government of the country, dictating what was going to happen. But you also had the interaction from the political perspective, where they were quite happy initially to accept that advice and then became more restrictive. So will you need something in the future where there is a broader mix on something like NEFIT that would make decisions like that? Also, you're going to have to prepare for, will there be another pandemic? Most likely, probably will. What are our preparations if that was to happen in say the next month? How are we prepared in terms of our health service, our public,
our ICU capacity?
Our ICU capacity.
People keep forgetting the
our
reason
ventilators and so on.
Restrictions lasted so much longer than everywhere else was ICU capacity. Ultimately, it came down to
our ability to not have our health service over flooded, basically. And we were learning from what was happening in Italy. Let's be quite clear. We were watching the 40 pages of death notices coming in from Bergamo. So you can go through all that. So you'd say this can be a valuable process if ultimately what you're looking for is recommendations into the future rather than trying to conduct a post-mortem on what happened in the past.
Shane, have you faith that we can avoid just a kind of a long drawn-out process of relitigating everything?
Absolutely not. Zero faith. And I think a lot of people listening would probably, like the people you talked to on the street would obviously have the same opinion as well. Like you look at some of the headlines in the UK papers over the last number of months, and Fionnan has mentioned some of them: mudslinging, blame game, pointing fingers, and even worse, you see in some of the politicians completely entrenched in the camp and the positions they took as well. So that's almost worse than denials of positions that people took at the start of the COVID pandemic and places in which people went wrong. Like if you ask the families of the Dalgan House, for example, in Dundalk, bereaved families, that this would be the start of 2024, still talked about. And this is a process, I think that they said, 18 months it's going to take at least. So, I mean, this is so far down the line for families that are waiting for answers. And the reality of the situation is they're going to be waiting a lot longer. And look, it's hard to know who's right and who's wrong, but that's exactly what you want to get to the bottom of. But these families of victims, and in Scotland they've been doing it right. They've been listening to the families at the outset of all these discussions, and then comes the political part, the part where the politicians are put before and basically told to entrench in their positions, and a lot of them have been digging down.
Fionnan, the turn of phrase that Shane uses there, who's right and who's wrong. Like, I suspect even if they decided, let's go back, let's relitigate every decision. Well, there's no clear answer to who's right or who's wrong. That's the problem with a lot of those decisions.
Well, look, it's based on the circumstances of the time. Are there decisions that were taken at the very start that would now, in retrospect, not have been taken? Quite probably, if people knew what was to come. We had the famous reopening for Christmas, which didn't go very well, or we slowed to lockdown.
I had a very meaningful Christmas for what it's worth.
A lot of other people didn't, though, who ended up getting sick subsequently in that January. So you will obviously have that great benefit of hindsight type of perspective. But at the same time, politicians don't tend to like to say that they were wrong in any decisions that they were taking. So I wouldn't hold out a whole lot of hope that you're going to get answers on things like Dalgan House, on issues like why were nursing homes not provided with adequate levels of support. I think it's also going to be very different from what you were seeing, the perp walk that's happening over in the UK, because let's face it, we do have independent authoritative figures also this week that show from the OECD that we do not have excess deaths in Ireland, which would imply that we certainly handled the situation that bit better than some of our counterparts. Not perfectly by any means, and there could have been a lot of things done differently, but I don't think we're in the same space as the UK are.
Yeah, and the other thing is, and there was this feeling at the outset of the whole thing, regardless of your political leanings in Ireland, we were a week ahead of the UK going into lockdown. A lot of people were appreciative of that. I think at the time, certainly in hindsight, that was a good thing. But now that we're so far behind the UK in terms of dealing with it, and this whole thing is just adding to it a little bit, and there's this skepticism that comes in. The longer it takes, people are like, well, do you want us to forget? Because that's what the general feeling is.
Well, P says people want a bit of juice from an inquiry. Were there secret parties smooching in the corridors of power? We want it all. Willie in Limerick says Sweden never to lockdown, never stopped kids going to school, never stopped them playing sports, didn't stop people entering premises without vaccination certs, had a low vaccine take-up. Yet a very low COVID mortality rate. Instead of an inquiry, we might ask the Swedes for advice. Well, Willie and Limerick, would you believe the Swedes have actually finished their inquiry? They have got it done and dusted. And what their experts found is that they should have locked down a little bit harder. Largely, they say they got things right, but they do recommend, in hindsight, that more things should have been restricted. There should have been further restrictions. And people don't like to hear that. Sweden is held up as this exemplar, but even the Swedes say, actually, we could have been a bit stricter and it would have saved a few more lives. So a few more details beginning to emerge. We were talking to Fionnan Sheehan in our afternoon update shortly after 4 o'clock about this today. So over the next little while, the terms of reference are going to be set. We're going to get strict time limits, and we're going to find out whether it will be a public or a private inquiry and what they are going to look at, what they are not going to look at, the pitfalls they're going to try to avoid. Here to discuss, Professor Sam Conkey, who's an infectious disease specialist at the Royal College of Surgeons in Ireland, and Michael McNamara, the independent TD for Clare, a former chair of the Oireachtas Covid committee. Gentlemen, you are both very welcome to the show. Sam, if I can start with you, what questions would you like to see a COVID inquiry look into?
Thanks, Kieran. I think I'd like to see an inquiry that points us to the future, that in the future we've more robust and resilient systems. Many folk will see with great sadness sort of the nursing home deaths at the early part of COVID. And, were there enough extra staff? Do all of our organisations have enough staff to cope with maybe 10 or 20% of people off sick? Many of us don't have those redundancies built into our important systems. So I'd like to see it forward focused, looking at resilience, looking at robustness, not just of health, but our arch nemesis might not be your dog. It might be a virus on the computer system that brings down our bank payment system. So I would see that we need, as a nation, to look at resilience of a wide area of water, food, banking, energy, fibre optic cables, our cyber security. So I know that's very broad, and probably this particular inquiry won't necessarily do all that, but I think that's the sort of questions I'd like to be living in a country that can answer those sort of broader questions. Have we built systems that are robust to the next threat to our security?
Do you think the inquiry should be public or private? Have you a view on that?
So I think there's for and against each. If it becomes sort of accusatory, almost like a court where people who are giving evidence feel that they're guilty, they're in the witness box, then it can become very defensive and doesn't result in the forward-looking answers to how to make a better Ireland in the next 5 or 10 years that I'd like to see. So I think it should not be a sort of a accusatory court case, because it's not a court. It's an inquiry to find out what happened. If you have an open tribunal, it can be slow, expensive, and lots of cross-examination. So then you end up going on for years. And we've had those sort of tribunals in Ireland in the past, not always with the biggest impact after several years of talking and questioning and funding. So I think a quicker, shorter one is better. Having said that, of course, Kieran, the openness of transparency brings a sort of a clarifying and healthy light to everything. So I'd prefer to see it open, but if it's possible to have one that's quick and not accusatory as well, I think that would be helpful.
I mentioned Michael McNamara, the independent TD, who's with us as well. Michael, have you a view on whether any inquiry should be public or private?
Yeah, no, I mean, I broadly agree with Sam. I think if you have a tribunal of inquiry like you had, previously with a broad remit of the type that Professor Conkey has proposed, I think it would be a very happy new year indeed for the legal profession. But I'm not entirely sure that it would lead to any very concrete recommendations. I think the one thing that really needs to be examined is the death films at the outset, when there were numbers of patients were discharged from the acute hospitals into nursing homes, and how that decision was arrived at, who made the decision, how it was communicated, what were the repercussions, and how sound was that decision against what was known at the time. Of course, we need to be careful not to judge actions that were taken then against what we now know, but rather what was known or should have been known at the time. I think the relatives of the families of people affected at that time deserve that, and I think that's very important that be carried out.
And I broadly, I'd find it very hard to disagree with that, and certainly the sentiment behind it, that the family of people impacted, deserve answers. It does kind of begin to lead us down the road, though, Michael, of relitigating the past, doesn't it? Like, that's the danger with this, that we just get mired in every decision. Was this the right thing or the wrong thing?
Well, no, that aspect of it certainly does, and maybe that should be treated separately, because that is inevitably about relitigating the past and looking at whether the duty of care that the state owed to those people was fulfilled or not, or whether because they were of a certain age they were considered not to be important. And I'm not saying that was a decision that was made, but we just need a lot more information about how that decision was arrived at. But undoubtedly, that does lead to a cross-examination. I think people would lawyer up, and there's no way around that. But then the broader issues that Sam pointed out, I think that's going to lead to very subjective judgments. About the appropriate nature of state interference in people's lives. What is appropriate for the state to do? What are the appropriate barriers of the state? Or is the state omnipotent, and does the state should it protect us from ourselves? Is that the role of the state? And I'm not entirely sure that that's something that would. It's going to be very subjective, so I'm not really sure that it would lead to very concrete results. But I suppose a couple of things strike me. I'm obviously not a medic, but I do know that sort of masks were not recommended by the WHO for viruses up to February 2020. Suddenly they were recommended. Lockdowns generally weren't viewed to be an appropriate way to deal with a pandemic, and suddenly they were. So I suppose obviously decisions had to be made and made quickly at that time, but now, given that there isn't the same pressure, maybe we need to determine whether lockdowns are appropriate to deal with the future pandemic in the event that one arises, and how effective masks are. Personally, I think having to wear masks in school was a relatively large interference in students' lives. Having to wear one visiting a family member in a hospital is a very, very small interference. Yes, that requirement was lifted, which surprises me. If they were as effective as the claim is that they were, then why was that lifted? I simply don't know the answer, but I think in the cold light of day, maybe that's something that could be usefully looked at. But certainly going back over every single decision that was made is not something that I think would be particularly productive, and everybody would look to vindicate the positions that they took. But as I say, families of of people infected and who died at the start of the pandemic do deserve justice.
Sam, with a view to equipping ourselves to deal with a future pandemic, how important is it that we have a discussion, whether it be as part of this inquiry, investigation, tribunal, whatever it turns out to be, about ICU capacity? Because it strikes me, I mean, that is the people kind of speculated as to why we had a much longer and more severe lockdown in this country than in other jurisdictions. And all too often, people forgot the reason for it, actually, a lot of the time, was ICU capacity. We just couldn't cope with a level of the disease in the community that other jurisdictions could cope with because our hospital system was already creaking at the seams before COVID appeared.
Yeah, so it is a case in Ireland we've less ICU beds per head of population than many other comparable countries. We did make a huge effort, as has been alluded by Representative McNamara in the previous speaker, that we needed to get people who didn't need to be in an acute hospital out of the acute hospital. It's not really a healthy way to have lots of people who don't need to be in hospital there. And the alternatives, of course, are to go home or to go to a long-term care facility like nursing home. So I would sort of reframe the question that you've been discussing just now about nursing homes and say, how can we make nursing homes and care facilities safe for people with infectious disease? And that involves PPE, it involves extra staff. And so it's a different question than just why were they discharged, because in my view, should have been discharged much earlier. The idea of housing people who don't need to be in a hospital and keeping them in a hospital for months and months is not good for those individuals either.
Have you confidence, Sam, that an inquiry will not become retrospective, or that the discussion and debate in and around it on programmes such as this won't just get mired in the past? You know, there's people already texting in, like agreeing with Michael, we absolutely need an investigation into what happened with nursing homes. Mike in Galway wants an inquiry specifically looking at the purchase of what he calls useless masks, gowns and ventilators that cost the taxpayer millions of euro. This all kind of gets into blame game territory in my mind.
I'm reasonably confident that there are tools of identifying risks and risk management and looking at scenario planning. And I would say the best people in Ireland perhaps who do this are the military. They're looking at what ifs and trying to make contingency plans for a whole series of diverse what ifs. And some viruses may be well prevented by masks, but others may be better prevented by hand washing or by other PPE. So, but if you do a whole range of what ifs for different types of threats, then you can have a plan in place, perhaps even rehearsed like a fire drill for a whole range of problems like Ebola or like anthrax or like a toxin in Dublin water supply in Blessington that would cause us all to get diarrhea, for example. So we need a very broad range of what ifs, and then a draft plan for each of those ready to go. In Ireland, we had a flu plan, an influenza plan, and we were sort of running the influenza plan in February 2020, obviously because we didn't have another plan. It took some weeks and months to get a more COVID nuanced plan. And of course, leading through an unexpected crisis, which you haven't been planning for, is really challenging. So I think we should be gracious to our leaders and CEOs and business leaders and owners of businesses who tried to keep their businesses and employees going and everyone getting paid through this completely unexpected 2 years that's, you know, nothing like anything we've had in the history of the state. So the ability to make decisions fast and nimbly and try to keep our economy going, which to me is profoundly important for healthcare. This dichotomy between the economy and health is a false one. You need a good economy to be healthy. And we've done that very, very well. We've come out of this COVID problem with a very robust economy and also very low excess deaths. So I would say the independent assessment, OECD or global burden of disease, they're telling us in Ireland that we've much fewer deaths per head of population than Europe or America or many other developed countries, comparable with New Zealand and Iceland.
Michael, you mentioned WHO advice. I mean, I doubt we'd have the powers of compatibility to force them to attend. But in that regard, would you like to see, say, Dr. Mike Ryan or Dr. Ghebreyesus, the Director General, contribute to our inquiry?
I don't. I mean, I just don't see that a big, long... I mean, undoubtedly, I suppose that the WHO's response to it will be looked at, but I'm not sure it's appropriate for the Irish state to do that specifically. I mean, you could waste a huge amount of time, human resources, and ultimately state money that should be arguably spent on providing home care for elderly people who need it, so they don't have to go to nursing homes, and providing additional ICU capacity and training and employing people to staff those ICUs, because that's the big difficulty with developing ICU capacity, rather than engaging in a sort of a legal extravaganza in Dublin Castle. That would be my view. But I don't want to sort of. I do think there are specific questions around the start of. I mean, there was a huge difference in the trajectory of the virus in Lombardy and Veneto. In Lombardy, everybody was brought in to residential facilities to be cared for. In the Venice region, people were treated at home, and that created a huge difference. So, what effect discharging people into nursing homes had, there was a specific decision. I do think that has to be looked at. But above and beyond that, I mean, I'm not really convinced that a big open-ended inquiry of the scale that Professor McConkey. But there are a lot of interesting questions, politically, philosophically, sociologically. But I'm not sure that
we'll have to wait and see how the state tries to answer them. Michael McNamara, Independent TD for Clare, Professor Sam Conkey from the Royal College of Surgeons in Ireland. Thank you both very much.